What is schizophrenia? Well, according to the Mayo Clinic, schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucination, delusions, and extremely disordered thinking and behavior that impairs daily functioning. Cecilia Makoff, who has schizophrenia, described it as the following.
I'm not much different than the rest of you. We all see, hear, and feel things when we're dreaming. I'm just someone who cannot turn off my nightmares even when I'm awake.
According to PubMed, the symptoms for schizophrenia can be divided into two: positive symptoms and negative symptoms. Positive symptoms are highly exaggerated ideas, perceptions, or actions that show that the person can't tell what's real from what isn't. Here, the word positive means the presence rather than the absence of symptoms. They can include hallucinations, delusions, confused thoughts, and disorganized speech, troubles concentrating, and movement disorders. Negative symptoms refer to an absence or lack of mental function involving thinking, behavior, and perception. This includes lack of leisure, trouble with speech, flattening, withdrawal, struggling with the basics of life, and no follow through. Coffee is one of the most popular drinks in the world. It contains a substance called caffeine. Caffeine is a stimulant that acts by blocking a neurotransmitter named adenosine. Adenosine relaxes your brain and makes you feel tired. Normally, adenosine builds up throughout the day. However, when you consume a drink that contains caffeine, it will block the adenosine receptors in your brain, reducing tiredness. Caffeine can also increase the levels of epinephrine, which makes you feel active and alert. Antipsychotic medications are the first-line drugs used for the treatment of schizophrenia symptoms. However, these drugs have a sedative effect, thus making you feel lazy and tired throughout the day. To counter this effect, some doctors usually recommend drinking coffee. Research found that moderate caffeine intake for schizophrenia patients can reduce some of the negative symptoms. In a clinical trial by Dalhousie University in Canada, comparing the effect between high and moderate caffeine consumption in schizophrenia patients, found that both groups experienced reduction in negative symptoms and better cognitive functioning. In the moderate consumption group, the subjects had better cognitive functioning but lower reduction in negative symptoms. The higher caffeine consumption group had higher reduction in negative symptoms but an increase in positive symptoms compared to the moderate group. So this means an increase in caffeine intake will lead to a decrease in negative symptoms but an increase in positive symptoms. A decrease in caffeine intake will lead to an increase in negative symptoms and a decrease in positive symptoms. So, to better understand this, I came up with the term the caffeine dilemma. So, what is a dilemma? Well, a dilemma is defined as a situation in which a difficult choice has to be made between two or more alternatives, especially equally undesirable ones. For instance, people are often confused between feeding themselves or feeding their cattle. So when it comes to caffeine and schizophrenia, the situation is similar. If you drink coffee, you will have better cognition and reduce negative symptoms like apathy, but you will have an increase in hallucinations, which is an example of positive symptoms. On the other hand, if you don't drink coffee, you will have a reduce in hallucinations, which is positive symptoms, but a decrease in cognition and an increase in withdrawal, which is a negative symptom. So now you're thinking to yourself, caffeine can be good and bad at the same time. I would just have to take it in moderation. But it's actually more complicated than that. Clozapine is a commonly prescribed medication for the treatment of schizophrenia. It has been known to be affected and sometimes even interact with caffeine to cause adverse life-threatening effects. A 35-year-old psychiatric patient who's on clozapine started consuming 600 milligrams of caffeine, which is equivalent to 4 Red Bulls per day, suffered a severe toxicity and multi-organ system failure, which was attributed to caffeine and clozapine interaction. Another clinical case report stated smoking and excessive caffeine use are associated with poor therapeutic response to clozapine. In 2021, a study found a potential use of caffeine to treat symptoms of schizophrenia. However, further research is needed. So, this video does not serve as a professional medical advice. I made this video to be informative, and I highly encourage you to consult your doctor before making any decision. The only recommendation I can provide is to avoid excessive caffeine consumption and to remember that moderation is the key. It's been well documented that schizophrenia patients usually consume 3 times the average caffeine intake of the general population. Therefore, it's important to be aware of the potential harms associated with it.